Hello, Facebook viewers. I believe we are live. Welcome to my Facebook Live. This is second week in a row. Last week, we talked about minimally invasive surgery. I'm a podiatrist. I provide, minimally invasive right ankle surgery. And we talked about some benefits of minimally invasive surgery last week. This week, I want to talk about office-based surgery. So why, as a specialist, we should consider the office-based or in-office procedure for your practice. Well, past 3-4 years, I noticed the market trend shift, right? Because of the value-based healthcare, as you know, insurance reimbursement is lower for doctors. However, the premium for insurance premiums going higher and higher every week. Every year. Every year. Co-insurance deductible increasing every year. So what happens to patients? They're hesitating to receive surgical treatment because most surgical procedures are done in the hospital setting or a large surgery center. And as you know, the co-insurance portion, 20%, 30% is typical. And without saying that, deductible, not uncommon to see $5,000 deductible. If you perform surgery in the hospital and surgery center, patients are aware now. They are aware of their responsibility to pay huge co-insurance, 20%, 30% of what hospitals and surgery center would charge. So obviously patients, they are holding up to receive the treatment, surgical treatment that they need. So that is number one reason why you should consider in-office. Oh, someone's texting me. In office, okay, so that's good. In office, someone was making sure I'm on live. In office, the surgery will have a benefit for patients. Why? Because I'm going to share this presentation with you that you will have huge advantage. Let me see if I can share this screen with you. Okay, so I already talked about this market trend, which is, let me see, the value-based healthcare, right? And then insurance network prefer office-based surgery suite. Why? Because they also know that if you perform surgery in your office, you save insurance company money as well. Does that make sense? Insurance company will have to pay hospitals and surgery center, but if you perform in office, insurance companies, they don't have to pay that. So I'll have some proof for you. And also, like patients, for example, I do minimally invasive surgery, and it is so easy to transition, from hospital-based surgery to office-based surgery, especially if you are a foot surgeon, in my case, and perform minimally invasive surgery, because it doesn't require fancy equipment. Really, it needs very foundation, the Osada drill, which I use for my minimally invasive procedures, and the Minicium fluoroscopy, which you can get, pretty very affordable price if you find the refurbished one with the guarantee. And then obviously other instruments that it's very cheap, very affordable. So you can lower, the setting as far as doing in your office, the investment goes, right? The initial investment to create office space suite. Then patients also aware of minimally invasive surgery options nowadays. They're in high demand, and patients prefer nowadays pretty much all over the body. They prefer minimal, right? Minimally invasive. So again, if you do that and then perform in your office, let me show you. Well, this is a quick the graph that shows value-based reimbursement. This is the value-based model practice that fee-for-service that used to be up here. Okay, and then now we kind of passed this transition period. This is transition period. Now fee-for-service somewhere here, unfortunately. And then the value-based reimbursement, hey, it seems like it's going up, but it's not. Okay, I don't know what this graph means, but in my profession, the bunion procedure, for example, right now, the Medicare in my state, around $500 to $600. That's max for 90 days. Grace period 90 days that you cannot bill anymore for your service that you provide, follow-up visits and x-rays and all the other possible additional treatment that is needed for that surgical treatment. You cannot bill. So it doesn't make sense to me to follow this macro and MIPS, so I opted out. Okay, I help other doctors to opt out through my programs. I also teach minimally invasive surgery with my program. But anyway, I'm definitely a proponent of MIS and office-based surgery for this reason. Okay, and then office-based surgery and MIS enable you to see that potential, the light at the end of the tunnel, to opt out, because you can create niche service, which is unique, offer, and then you provide the best service, best treatment solution for your patients at lower cost for them, because they don't have to pay surgery center or hospital, remember? So even if you opted out and then you charge what you are worth, still patients end up paying less than you in network and do surgery at the hospital and surgery center. Does that make sense, doctors? If you're confused, please leave me a comment and I can answer for you, because remember, this is live. So if you have any questions, just put it in a comment. If you're watching this video later, not live, still you know how to connect with me. Here's my page. Just put a comment there when you're watching this video later, then we can connect. Anyways, so isn't it make sense, doctors? You provide a niche service and in-office procedure for your best surgical treatment solutions, and you offer them as a nice package to your patients. And patients eventually, they'll end up saving money. Then, they don't have to go to the big hospital, go through, meeting new people and go to a pre-op holding room with a bunch of other patients and move to a surgery OR and then come out and recovery room. All that can be done in your own office, where patients will feel comfortable because they only deal with you and your staff. Mostly in office procedure for MIS is done local anesthetic, so patients don't have to go through, sedation. They go home walking right out with surgical boot. You can really provide, high quality VIP service in this manner. However, even if you still scared and you're still taking insurance plans, for example, like Medicare, which I don't participate anymore, But I still see Medicare patients, don't get me wrong. I still see patients. But as far as reimbursement, even Medicare, this is last year stats I want to share with you. Well, so I already talked about this, right? New opportunity, MIS and office-based surgery, great combination to pull off for your private practice if you want to build that unique service and be the leader and authority in your neighbor, in your region. But anyway, this is my office-based surgery suite, okay? It is really nice and simple. As you can see, I have a, OR table, which is my special podiatry exam chair, the power chair, and then you can see in the background the fluoroscopy, and pretty much that's it. You clean, you use sterile techniques, you use autoclave, you sterile package, sterile drape patient, and then just like exactly same protocol as how typically surgery center will run. You do need to know the protocol in document, obviously informed consent, and educating patients about how this office-based surgery goes. So those documentation and education is very important, right? To run safely, properly, not only for your patients, but to protect your own practice as well. So, you can see, you can go to my YouTube channel, even Facebook. I have a lot of testimonial videos which patients talk about office-based surgery, how nice, how convenient, it was for them, cost-wise, and also their experience of going through surgery. But here, this is what Medicare RVU. This is exact, excerpt from AMA.org. So I didn't make this up, okay? But this is for podiatry procedures. 28285 is typical hammer-toe procedure. You can see non-facility is 589. That's the office-based surgery. But if it was facility, it was 417. This is again the last year's stats. I don't know now, but probably not far from here. 28308, this is typical lesser metatarsal osteotomy. But you can see if you do it in the facility setting, it's 420. You get reimbursed by insurance company. We're just talking about procedure, okay? I'm not talking about facility fee, facility charge or anything like that. Just the pure procedure. And I don't charge facility fee in my office. I don't need to. Anyway, so it's $626 for same procedure if you perform in your office. But imagine how much you're saving money to insurance company and Medicare. Does that make sense, right? This is bunion procedure, 28296, typical, the first metatarsal osteotomy, bunionectomy. Facility, 567, but office-based surgery, almost $1,000. You see, almost 100%. Twice. You will get reimbursed twice for doing exact same procedure, but if you do it in the office. This is double osteotomy, first metatarsal osteotomy, along with proximal phalanx osteotomy, 646 versus 1100. Okay? So I hope, this kind of gives you an idea how much you're gonna get benefit, because you get, some of them like pay twice as much, and then you don't have to commute to a hospital and surgery center to wait for your turn. As you know, a lot of times it gets delayed, postponed, and then you go through all the traffic for nothing. Drinking those bitter coffee, waiting for your turn, and then after you finish your procedure, you have to drive all the way back to your office. Pretty much half of your day is gone. I don't do that anymore, to be honest with you. Right now, past 2 years, I don't go to hospital or surgery center. I focus less things, right? I focus on minimally invasive surgery, if it's surgical treatment. And then I perform pretty much every surgery very rarely, if patient selection, right, patient criteria not fit for office-based surgery, I would take them to the surgery center, okay? But like 9 out of 10, I perform all of my procedures in my office space. I have all the protocols set up. It's streamlined system and process in place. So, I highly recommend and advise you to consider office-based surgery. And to do that, minimally invasive surgery, again, it's very nice, very smooth transition, smooth combination. It's perfect hybrid to work with, minimally invasive surgery and office-based surgery. If you have a question, let me know. And I do have, special mentorship program to accelerate this process, so you don't have to go through on your own. Learn minimally invasive surgery, learn how to set up all of your office-based procedures, and I'm talking about like documentations and how to train your staff, gown and gloving and draping patients, all that. I do have accelerator program that can help you implement much faster pace and shorten the learning curve and get you going and start increasing your revenue and maximize your time, because time is most invaluable asset that you have, and I don't want you to waste your time and energy trying to do it on your own. So hey, that's the main objective of my Facebook Live this week: the power and benefit of office-based surgery suite. I think that's it. So, it was quick. Great to seeing you. I'm getting used to how I use this new platform. It's kind of different. I'm not going straight into Facebook. I'm using different platform, so I can like share my computer screens and etc. So I might here and there have some tech hiccup, but we always just get better as we do more. So I'm planning to do this live every week to provide you some kind of value about minimally invasive surgery or business skills, marketing skills, ethical persuasion, how to communicate with your patients in order to build what I call hybrid concierge service, so you don't have to rely on insurance plan. So stay tuned. If you haven't done it yet, like my page, my business page, so you get notice if I announce or schedule Facebook Live, announce any kind of other live webinars that might be super beneficial for you. You don't miss out. Sounds good? All right, doctors and viewers, thank you very much, and I'll see you next week.